Good afternoon, everyone. County Board Chairman Rand and I are going to continue to alternate on these afternoon briefings for everyone. Last Friday, Governor Pritzker took progressive action when he issued the executive order to stay at home, and I thank all of those listening who heeded that call and are protecting yourselves and each other by sheltering in place. You know, we're only a couple days into this shelter-in-place order, and as the days start to add up, we urge everyone to please try to practice patience. Not everyone has the ability to compartmentalize some of these stringent policies, but as we've said before, calm is contagious. Do your best to help others minimize some of these stressful situations. So as we're adjusting to being in our homes and changing our routines and adjusting to this new normal, which is not normal, there are many working in essential businesses who are continuing to work and go to work to perform things that assist all of us. So to our neighbors who are working in the grocery stores, working overnight hours to restock the shelves, to clean the stores, and then open their doors again the next day so we can get those vital things, we thank you. To the restaurant workers who are working on the grill and prepping food to deliver curbside or driving to deliver essential food to feed others, we thank you. To the cashiers, the clerks, the pharmacists, hardware store employees, utility workers, bank tellers, gas station operators, all these people performing these tasks so we can continue to operate, we thank all of you. There's truck drivers, warehouse workers, farmers, trade people, postal workers, public service employees, and more who continue to work to serve all of us. I had got into a discussion with a gentleman who works two jobs. One is a school bus driver and the other at a grocery store. And even with the uncertainty of losing one of those jobs, he was serving customers with kindness and patience. And there are people like that helping us all over this community. We are staying at home, but we're still connected to each other in our community. On those occasions when you have to go out, please take what you need and leave some for others. Please continue to practice social distancing and remember that we're all in this together. And remember to thank those that are working for all of us. We're working very hard to provide you with relevant, important, and up-to-date information through many different sources. It's very important to stay informed with the most current information. We urge everyone to please continue to follow the Peoria City County Health Department website for the most up-to-date information and or to call 211 or 309-299-4029 for if you have other questions or need additional information. Now I would like to introduce Monica Hendrickson, the administrator for the Peoria City County Health Department.
Thank you, Mayor Artis. To begin our Monday briefing, the counts to date for Peoria, Tazewell, and Woodford counties. The combined tri-county to date are 8 positives, 55 negative tests, and 32 pending. The increase from the previous weeks of 3 include those that were part of contact investigation for prior positives, as well as individuals related to travel experience. Overall, these numbers don't surprise us as we continue to see throughout our communities with 31 counties now reporting at least one positive case in their jurisdiction. The mayor really touched base on all those individuals that are working to provide those essential services for our community and making sure that as a community that we are utilizing those services in a manner that allows for all of our community to actively have goods and services that are needed. One of the things that we like to always recommend that while these essential services are operational and that shopping in grocery stores or other entities is available, please try to remember that minimize the exposure of your family in those situations. If possible, designate one individual in your family to run those errands, to making sure that you're limiting not only your family's exposure, but also for those essential service operators in those communities that are serving us day in and day out. During this time, while we have been focused on COVID-19, there is still services and health needs that are being needed in our community, and one such is blood drives. So with that, I'd like to introduce the Executive Director for the American Red Cross, Linda Hureska.
Thank you. I want to offer our appreciation and gratitude to the medical professionals, first responders, and the many organizations providing essential services. We are so grateful to you. Every 2 seconds, someone in the United States needs blood. The United States is facing a severe blood shortage due to an unprecedented number of blood drive cancellations. To date, more than 6,000 blood drives have been canceled, and these equal 200,000 shortage of blood donations. Here in Illinois, over 120 blood drives have been canceled. Blood collections is an essential function as outlined by the Center for Disease Control and the Food and Drug Administration. One of the most important things that we can do to ensure that we do not have another healthcare crisis is to give blood. Like a hospital, a grocery store, or a pharmacy, a blood drive is essential to ensuring the health of our community. And the Red Cross will continue to hold blood drives during this challenging time to help meet patient needs. The blood shortage could impact patients needing surgery, victims of car accidents and other emergencies, or people who suffer from chronic illnesses like sickle cell disease or cancer. We're expecting cancellations to continue to increase, which is causing heightened concern for blood collection organizations and hospitals across the nation. The Red Cross understands that people have concerns about public health at this time. I want to stress that donating blood is a safe process, and healthy people should not hesitate to give. It is important for you to know that trained staff follow thorough safety protocols to help protect donors and recipients from any type of infection. We are asking everyone to please make appointments. We're currently running our blood drives with new safety and health protocols, which limits the number of people who can come in as walk-ins. The severe need for blood will continue today, tomorrow, and in the weeks and months to come. So we ask that if you're healthy and able, we ask you to make an appointment to give blood. Thank you to everyone who has answered the call. We appreciate you.
Thank you, Linda. Our next speaker is here to talk about senior health, especially in terms of mental health. Dr. Ataluri is the Medical Director for Senior Behavioral Health at Unity Point Proctor, and really to focus on that high-risk population are most vulnerable and what kind of coping strategies they can use during this time.
Thank you, Monica. I'm here basically to talk about mental health, mainly focus on seniors. As you know, as we are focusing on isolation and physical well-being, the mental health issues are also very, very important. What the seniors to be aware of is be mindful of the anxieties, worries, and sometimes sleep pattern changes, mood changes, appetite changes, and also they need to think about if there is any increase in alcohol use, any smoking, etc. Any previous mental health issues, they may get worse during this time, and what seniors can do. Number one thing is there is so much news out there. If they keep on focusing on grabbing all the news and watching TV all the time, that only increases the anxiety and worry. It worsens it. And they also have to be mindful about thousands and thousands are working for all of us to make normal person's life easy. So focus on the positive news. Times like this, there is always negative news and positive news. Focus on the positive news that can be helpful for us. And also focus on you rather than on everything that's going on in the country or in the world. Try to eat well, sleep well, and try to be active both emotionally and physically. Even inside the house, you guys can take a walk. And nature is still on our side, so you also can go out of the house and make a walk around the house as long as you keep the distance. If anybody else in the streets, 6 feet distance, you can still be physically active. The other thing is keep a daily routine, like taking a shower and get into regular clothes, and keep the routine as much as possible as you always have done, and mindful about your own worries, your own anxieties, and your own thoughts and your emotions and feelings, and also mindful about how you are feeling physically. If you are not accepting or not acknowledging those worries and anxieties, they will show up in some other way. So acknowledging them, talking about them, and keeping in touch with the friends, family, either by phone or virtual activities like a Skype or some kind of a FaceTime video, all those things are also helpful. And the last thing is, if anything needed, reach out for the mental health professionals. UnityPointPlus.org has all the numbers for ERS, crisis, and service numbers. And what the families can do is keep regular contact with the loved ones, parents, and seniors. And if there are any younger neighbors, they can look out the older senior citizen neighbors, knock on the door and see what they need. And the last thing is families can also teach, if any of the seniors need to know how to go on Skype, on video, or Google Hangout. These are some of the sites that you can be more active socially. This may be the time you can get hold of that grandchild, grand teenage child, or somebody who is always active. This is the time to get hold of them, have a chat with them. Appreciate this opportunity to talk about this, and thank you. Thank you, Monica.
Thank you, Dr. Ataluri. With that, we'll open it up to questions and answers from the media.
Which counties have new cases, and how many of them are from the PIA air traffic tower?
I don't necessarily know about the air traffic tower, but I believe as one additional county was added today, giving us to, I think, 31 counties.
In terms of the 3 new cases in the Tri-County area, which counties were those cases in?
The 2 additional cases were Peoria, and 1 was in Woodford. And again, of those additional cases, 2 were related to contact tracing. These people were already part of the investigation, were already self-quarantining, monitoring their symptoms. And the other case was an individual that was related to travel and who's also been self-isolating and monitoring their symptoms.
So Tazewell County has still no confirmed?
Tazewell County still has no confirmed positive cases.
Do we know if the case at the Peoria International Airport Control Tower was somebody who lives in the Tri-County area?
So I think it's important to understand that the data from the FAA website, that I think it was what was regarding the case, the FAA's timeliness in reporting is different than that of local entities. We report our cases within 24 hours to the media, and as well as the Illinois Department of Public Health updates it. In fact, the website for the Illinois Department of Public Health has not updated the 3 new cases in our region, so we try to be very much active and put that information up front. In regards to the FAA, their process is much more extensive and not necessarily linked to the local entities, but through their federal agencies. And so I can't speak directly to that case, but I can say that that case was reported to a local health department, and that case was reported a while back.
Was the Woodford County case travel associated?
No.
Something, I don't know if you would want to speak to this or the Red Cross. We've had some viewer comments believing that if they donate blood, that blood would be tested for COVID-19, just looking.
I will leave that to our expert here.
Hi there, can you restate the question, please?
Yeah, so we've had some viewer comments believing that if they donate blood, that it will be tested for COVID-19, just looking for, kind of clarification on that confusion.
Yes, while we do test for a wide variety of viruses, COVID-19 is not a virus that would be tested during a blood donation, so.
What procedures are you guys taking now during blood donations to make sure that nobody is getting infected or anything like
So the
that?
question is, what precautions are we taking? We're adding social distancing, so the donor beds are at least 6 feet apart to make sure that we are keeping people safe that way. We're also adding some safety protocols. We're scrubbing down the beds between donors. All of our phlebotomists are using, they're gloved, and they change their gloves after each donation. So again, exercising more hygiene precautions as well as the social distancing.
Are you still distributing like cookies and juice and everything to donors after they donate to try to get their blood sugar back up? And if so, what are you doing to make sure that's protected, so to speak?
Sure. The question is, are we still providing snacks following a blood donation? That's protocol to make sure that we have an opportunity to watch that donor for a few minutes and to give them a drink and a snack. We absolutely are. The canteen workers or the volunteers who are helping are also gloved to make sure that food is safe to distribute.
Is staff being monitored? Are their temperatures taken when they come into work, that sort of thing?
Everybody that enters a blood drive, thank you for bringing that up. The question was, are staff having their temperatures taken? Staff and volunteers, as they enter the donor room, have their temperature taken to ensure that nobody's entering the room who might already be compromised. Thank you, Monica.
Are there additional questions?
I have a question for Mayor Artis.
Mayor Artis.
I have one for you.
Okay.
Yeah. Would you go ahead while we see if he's still
Since
there?
you're here. So we've had some people contact us saying that, they've gone to the hospital and basically any other virus test has been done on them. And then without getting the COVID-19 test, they've been said because of, process of elimination, and since you aren't presenting extreme symptoms, we're just gonna say you have it and we're gonna put you in isolation and we're not going to test you, and those numbers aren't going to, count into what you would tell us. I guess, can you talk about that and how that impacts the numbers that might actually be in the community?
Definitely. I think the question is, without universal testing, how do we understand what the full range of cases are in our community? And I think that's a great point, and reason why having those larger discussions as a community, such as staying home or sheltering in place types of policies, are really important because you really can't rely on just confirmed cases. Understanding that not everyone is going to be tested, really recognizing the fact that for every one person, there's going to be a large population that doesn't. So while we are reporting that in the Tri-County, there is 8, and we're reporting that Tazewell County currently does not have a confirmed case, that does not mean that it's already in the community. And I think that's why these precautions are really important, and why as a state, I appreciate what they're doing to kind of move this forward, because 102 counties are in our community, and if only 31 are reporting, you might still think this is a very small issue, but it's because that's only based on confirmed testing. And so that points out a reason why people should understand it's much more apparent in our community, and why sheltering in place, staying home, doing that essential is going to be a really important role.
And then one more for you, since you're there. Seeing, a lot on social media and even in the national news, people, wanting to do their part when it comes to supplies. And, we're seeing people making their own masks from home, and obviously, with the best of intentions. But just wondering kind of what is the protocol in terms of, is that sanitary? And if you brought that to a hospital, would they use it? Or is this kind of just people doing something that wouldn't be used?
So I think there's a wide range of people wanting to make masks, whether or not they're fit for hospital settings or for other places, kind of come into play. And I think what happened here in Peoria, which is really important, is understanding that we recognize that Peorians are great people. They are. They're willing, they're giving. It's a great community, willing to give so many resources. And that's why through 211, the donation center was created to really support that giving nature of our community and really have a way to, kind of focus and collect all of that good information and then make sure it's distributed to those that need. So that it's kind of a matching program for donated goods, whether it's volunteers, materials, or even funding, and making sure it's going to those agencies that can better utilize it as well.
So you're not sure?
I think some, right now there's still some interest in it. I think what's going on in the hospital and healthcare systems is we're still using our state and national stockpiles. We're getting materials in, so we're not necessarily at that point. But again, if individuals are interested, they can contact 211, and there might be another agency that could utilize those type of masks.
Before I answer your question, it reminded me when Monica talked about how great people were around here, someone sent me an email this morning and said, why don't you recommend to people that are staying at home, staying in place, if they go out for a walk, but both for physical and also mental health, tell them to take a trash bag with them and pick up litter as they're walking. So, they're going to feel better about themselves, they're going to get a little exercise, and they're also going to be able to help the community out by picking up trash. So that's another good one to add to your list. So, who had a question? Treasurer?
There's talk that businesses, despite the order to shut down for dine-in, are still open and still serving people. Are there any fines in place for that? And how would you all go about figuring that out? And if they are open, why is it that they are able to do this without any consequence as of yet or now?
Well, we've had a number of folks calling or emailing with concern about some businesses that maybe they should or maybe they shouldn't be open. Our patrol officers are also monitoring some of those situations or just on their own if they're noticing them. There is an enforcement side to this, which the governor has pretty much left to state and local sources to enforce. And we haven't done that yet because we haven't actually seen a bar that's open and serving people or a restaurant that's not complying with either carry out or pickup. If and when that happens, we will. I mean, they're jeopardizing not only their food license from the health department, but their liquor license from us. And to jeopardize that, to get a couple bucks versus not having it when we come out of this is, I think that in itself is probably enough of a deterrent for most people. But if we do see that, we will be able to respond to it.
So right now it's just that if you do see it, there's nothing that you all do every single day to make sure that businesses are closed for dine-in?
Well, just keep in mind that our law enforcement folks and most of our city people are still doing their regular jobs and going on their regular calls and everything else, and we don't have a mechanism within the organization to have people just checking for compliance. But really, in a lot of these cases, regardless of what the business is, we really see that it's self-regulating. The businesses are self-regulating themselves. If they're open and they shouldn't be, and they're sitting in their shop all day long and nobody comes in, they're obviously not essential. And people aren't looking, or we have not seen people looking to try to go to some of those businesses that aren't supposed to be open. The communities, the businesses that try that, nobody's coming in. So we think the self-regulation is going to deter a lot of that in itself.
Mayor, during Governor Pritzker's speech today, he talked about how possibly tattoo parlors and nail salons should help donate supplies. Is something that you want to encourage locally here?
We absolutely do. I mean, people that, in some dentist's office, other places that have that type of PPE that could donate it to the hospitals and the healthcare people that need them, we absolutely encourage that. Thank you. Okay.
Are there any other questions from the group? Okay, if not, then we will see you again tomorrow at 4 o'clock. Thank you.